Hello, everybody. Can you imagine that every cesarean section you scrub in the operating theater is 20 times polluting the planet? Nobody teaches you, and the Royal College now is impacting on the carbon footprint of obstetrics in exams and in lifetime clinical decisions, and we will discuss this important topic. Let us see the carbon footprint of obstetrics, 20 times the carbon impact of one anaesthetic gas over another. Every cesarean section you scrub into has a carbon footprint. This is a fast becoming an examiner favorite for MRCOG Part 2 topic in the next few minutes, where theater emissions actually come from, what RCOG is doing about it, and exactly how to answer this if it shows up in your exam. Let us start by why this an exam relevant topic now. Healthcare paradox is the sector that heals patients is also a meaningful contributor to the emissions driving climate related harm to health. Theaters are carbon hotspots. Operating theaters are disproportionately carbon intensive relative to small share of inpatient activities they represent. It's now a college priority. The RCOG Green Maternity Challenge and the 2025 Green Maternity Report place this quarterly within current examination RCOG indicators. Where the emission come from and what fixes them? There is 4 sources of theater carbon emission gases: volatile anesthetic agent, example nitrous oxide, energy theater HVAC systems, which is the heat, ventilation, air conditioning systems, waste, single use, disposables, and the first mood care pathway choices. What about the RCOG aligned solutions? They use low carbon gases, avoid disflurane and nitrous oxide where clinically appropriate, reusable equipment, sustainability, quality improvement, and the 5 R's framework. What is the 5 R's framework? Reduce, reuse, recycle, rethink, and research. What about the pathway redesign, continuity of care, and infant feeding support? What green maternity care looks like in practice? For the RCOG Green Maternity Report 2025, priorities include better information sharing and continuity of care, reducing duplicated appointment and unnecessary travel, infant feeding support, breastfeeding carries maternity materially lower carbon footprint than formula due to the emission associated with dairy farming. The 5 R's framework we discussed in the previous slide: reduce, reuse, recycle, rethink, research, a clean, quotable mnemonic used across green surgery literature, local service redesign, bringing screening and follow-up closer to patient cuts, post-travel related emissions, and health inequity. How this could appear in your MRCOG exam? Likely questions then to discuss the environmental impact of anesthetic choice in obstetric theater, outline strategies to reduce the carbon footprint of a maternity unit, what is meant by sustainability, quality improvement. Maybe this is a likely exam, or the key terms to have ready: net zero NHS target, net zero emission by 2025. And the sustainability quality improvement methodology, life cycle assessment, and the carbon hotspot, an area of disproportionately high emissions relative to activity. So what about the 4 sources and the 3 solutions? Also one exam ready answer. The sources: anesthesia gases, theater energy, HVAC, single-use waste, mode of birth. What about the solution? Low carbon gas choices, sustainability, quality improvement, and the 5 R's framework, care pathway redesigned. This is our reference from the Royal College. If you find this video useful, subscribe in the channel, and also subscribe by email to receive your quick reference, a free quick reference card. You will find in the description of the video. Thank you and see you in next video. Bye.